Let's get a little bit of reaction to the interview that we just had with Health Minister Dr. Zweli Mkhize about the National Health Insurance Bill. There's been lots of reaction. One of the reactions comes from the Institute of Race Relations. They've been very vocal about their opposition to the NHI bill. They say it will increase taxes and lower the standards of healthcare in South Africa. In studio with us, we've got the IRR Head of Policy Research, Dr. Anthea Jeffery, in studio. Dr. Jeffery, thanks again. Thanks for coming to visit us here at Morning Live.
Thank you for the opportunity.
You obviously heard what the Minister had to say. Let's get your immediate reaction to some of the things he pointed out to us this morning.
My concern is that we're again being given a great deal of reassurance that the public service will be made much more effective, for example. And yet we know that 4 billion has been spent on pilot projects for the NHI with no measurable improvement visible in them. And therefore, one would imagine the state has put a lot of effort into trying to get things right at those sites, and yet it hasn't succeeded. So just reassurances are not enough. We also need to take account of the fact that at the moment, if you look at the capacity of public hospitals and clinics to comply with basic norms and standards of healthcare, very few are able to do so. So right now, if the NHI were to be introduced tomorrow, 1% of public clinics and facilities would qualify for accreditation and the remainder would not. About another 14% would have to meet conditions and then they would qualify. The remaining 85% are so far out of the ballpark that they need a great deal of work before they can qualify to take part in it. And at the same time, we know too that there's a great deal of concern within the private sector that if the government is going to be setting fees for private practitioners, and there's no distinction between public and private costs. For practitioners in the public service, many of their costs are covered by the state. For the private sector, that's not so. So if they simply get the same fees in both spheres, private practitioners will battle to cover basic costs, and that will become another impetus for them rather to leave the country than subject themselves to the NHI, which has controls not only over what they can earn, but critically how they can practice medicine, because the government will have complete control over so many things. The treatment protocols to be applied, the medical devices, equipment, medicines to be used. And in addition, it'll be setting prices for everything. And often the prices that it recommends may be unrealistic, or it may decide simply to exclude a whole number of very useful medicines and devices that will be excluded because they're too expensive.
The Minister went as far as to say that this is not nationalisation of the healthcare system. From your understanding, do you think this looks like nationalisation of the healthcare, or, with government controlling it, or is it work in a different way?
I think he's essentially playing with words, but there won't be a direct expropriation. The government is not going to take ownership of every private hospital and every private practice. But there is such a thing as regulatory expropriation, where the government's regulations impose so many controls on private entities that they lose many of the normal powers and benefits of ownership. So, for example, a private hospital being able to set the fees that you feel will cover your costs and give you a return, which is essential if you're to remain in business.
But they do overcharge, and we do know this. I mean, when you go into a private facility, you go and see a private doctor, the prices are escalated. I mean, sometimes 300 to 400% escalation in prices. So those that are on medical aids, we do know the fact that these private hospitals and private facilities do charge far too much, and there needs to be some form of regulation. But on the other side of the scale, we see what happens in the private sector, and I mean in the public sector, and it's a great worry, and nobody can get away from that and escape the fact that those institutions are not run well, and we are losing so much, and we don't want that to filter in. We'd like to find that fine balance, I imagine.
If you look at overall increases in costs in private healthcare, they're going up at very much the same rate as costs in public healthcare are doing. If you look according to the government's own figures over 5-6 years, the average increase is about 9% a year, whether it's public or whether it's private. But there are ways in which the private healthcare costs could be brought down. In particular, it's often the costs of government regulation that have pushed up the costs of medical scheme membership. through, for example, open enrollment, community rating, and the introduction of the prescribed minimum benefits. And there was to be a sort of compensatory regulation as well, that medical scheme membership would be compulsory for everybody, and then you would have a wider risk pool, and then costs could come down by 20%, has been estimated. In addition, the government has refused to allow, so far, the introduction of a low-cost medical scheme option. This was mooted by the Council for Medical Schemes in 2015 for introduction in January 2016. It would have allowed people to join a medical scheme for 200 Rand per person per month, and that, the Council estimated, would extend membership to something like 15 million more people. And yet in the end it didn't proceed. And what was rumoured, what was reported, was that the ANC was very opposed to it proceeding because it would be competition to the NHI, because it would undermine the case for proceeding with the NHI.
Yeah.
Just so we can look at other ways of addressing costs.
Of addressing it. Just very quickly, if you could keep it as short as possible, what do you propose as it stands right now? Because we are wholly, grossly unfair with medical treatment in this country, and there needs to be a solution, and very, very quickly, to get equitable and universal health care to every single South African. What do you propose should be done?
Three key things.
Issues. Yeah.
Sorry, really fix the public health service, which you need to do through merit-based appointments, not cadre deployment, by accountability for poor performance, by having an effective competitive system of procurement free of state control, often by using a private-public partnership so you get private sector efficiencies brought to bear. Secondly, in the private sphere, we need to have those low-cost medical schemes that would allow many more people to meet their healthcare needs, particularly at the primary level, from the private system. That would also help to lower the burden on public healthcare. We should have healthcare vouchers funded by the taxpayer, which allow those who are unemployed also to join medical schemes on this low-cost basis. And thirdly, we must have very many more healthcare professionals. Often they should be trained by the private sector, because the government one doesn't have the capacity to do that. And we must have an emphasis on innovation and competition rather than state control over everything, which will simply actually add to costs through all the inefficiencies of the bureaucracy.
Dr. Anthea Jeffery, thank you very much for talking to us. Head of Policy Research at the Institute of Race Relations, talking to us about the NHI bill that is hoping to come into effect in 2026. Thank you very, very much for your views. Let's take a break. We've got sports news after this. Do stay tuned.